Good morning, everyone. Welcome to our regular Truckee Meadows COVID risk meter media call. Hope everyone's doing well. We have some positive news to share and some good momentum that we've made in our community. And so with that, I will pass it over to our host today, Reno City Council member, Naomi Dewar.
Well, welcome everyone. And I've lost track of how many COVID media briefings we've had, but it's been a lot. And the reason it's been a lot is that today, this week, we are really marking the 1-year anniversary since the first case of COVID was experienced in our community. And so it really gives us a time of taking a moment for reflection, contemplation, and looking back on where we've been and where we have yet to go. In terms of where we've been, some 43,000 Washoe County residents have been affected by COVID-19 in terms of having the illness themselves. And some 649 have actually passed away. And that is such a sobering statistic to contemplate that it kind of takes your breath away. On the positive side, this gave us an opportunity to develop a brand new tool, the COVID risk meter, which has helped us sort of plot and chart our progress during the pandemic. It's brought groups of people together that have never worked together and given us an opportunity to really develop some relationships, some cross-functional, cross-team relationships, again, that I don't think we would have seen unless we had come together in this kind of setting. So this pandemic, as horrible as it has been, has certainly created a new phase of life for all of us, for both good and for bad, obviously. We want today to talk a little bit about how we have responded to that pandemic, what the COVID meter is showing us, and what is happening in the world of vaccines, which has really been the game changer. We've had new news from the CDC, new news from our Washoe County partners, new directives from the governor. And so we'll make an attempt to begin to get our arms around some of that here today in this briefing, but I'm sure those issues are going to extend over a number of briefings. So with that, I'd just like to turn it over to Dr. Jeremy Smith, head of the Regional Planning Agency, who is going to walk us through the meter and give us what I consider to be some very good news. Jeremy?
Thank you, Councilmember Dewar. I agree. We have some really good news to share. Today my plan was just to show us the COVID risk meter website. There's a couple features that I want to highlight on there, and plus we can see the meter. Are you guys seeing the site?
Yes.
Great.
Yes.
Okay, so as you can see, the needle is in yellow, and so this is a really exciting development that we kind of knew was coming. And actually, as we've talked about previously, we set this gauge every Monday based on the past 7 days worth of data. And we are cognizant to be a little quicker to respond to go up and escalate the meter gauge setting in response to conditions than we are to bring it down. We want to make sure that, if we are downgrading the meter setting and the associated guidelines, that, we're convinced and it's been a stable transition. And so that's really what we've seen. Now we've seen over the past 2 weeks, all of the days have been in this yellow condition. If we scroll down a little bit, you can see the daily bar for yesterday was at a 4. And if we take a closer look in here at this graph, you can see that since about the 18th of February or so, in that range, we've been scoring pretty darn consistently in that first yellow tick area. So it really looks positive in that sense. What's really driving that? Well, I think what you can see over here on the left, you can always see this every day I update this graph, is that our overall model scores are very low in most of these, in all the categories really. The maximum you could achieve would be a score of 3, and so what we're seeing is 1s, and that's really good. I wanted to highlight this new feature, pretty new feature, that's on the site. You can go now, and you've always been able to click in and see each of the individual data graphs, but now you get a little window in without having to click, and you can see these little arrows every day and actually see the score we're using in the model to calculate the overall score. And what I think you can see from this portrayal here is that everything is green and everything is pointed down. And so that means that all of these measures that we're tracking are going down based on where they were the day before is really what this is about. As I showed, we've been watching the risk assessments fall over the past several weeks. They continue to fall. Test positivity keeps coming down, now at 5.1%. New cases daily per 100,000. Our threshold to go to the next model score is 9. So we're right at the edge of what could take us, back up a point or down a point, but we have a little wiggle room in that yellow zone to account for that. And where we're doing pretty good is certainly in hospital bed use and capacity. I'll show you that one. So you go in, right, you get a couple graphs. Now you can see not only are these graphs auto-generated, but you can hover over any point and you can get the value, which is a really nice option. And you can see how the model works. So in this case, total hospital bed use, we're tracking a 7-day average of total hospital inpatient counts. And you can see for a while we were in this upper kind of scoring 2 zone. Right now we've been in the, for a long time, scoring 1 zone. And in fact, in terms of total hospital capacity, we've gone now down below 70%. And so according to the numbers I'm getting from the Nevada Hospital Association, there's quite a bit of room at the inn, if you will. Same thing going on in terms of the ICU bed use. You can see it's down quite a bit. One thing that has happened in the past several days is that the medical intervention side of things, so the number of COVID patients that are in the hospitals and in the ICU, has stopped its precipitous decline and has stabilized. And so you can see that in the data here. Back in December, it was super high in terms of total number of patients with COVID in the hospital, and that's been coming down, but it's starting to flatten, and even more so in the ICU use, starting to flatten. But these numbers are very small now too, which is very good. So they're averaging on the order from 8 to 12 people in the ICU, which is different than we were several weeks back. So things are looking really good on the data front, and we're in the yellow. And now it's the push to stay vigilant, right? Continue to get vaccinated, continue to follow the rules that are established by any business or entity you go into, that the governor talks about, that local authorities talk about, and to just keep this good trend moving forward. Thank you.
Well, that is a fantastic report, Dr. Smith. So impressive. It's incredible to see the great decline in those scores, what that looks like. So I'm glad we did put the meter together and we can actually visually see this over time. Let me ask Aditya Nair, our doctor of astrophysicist, I think, from UNR. What do you have to tell us about the future?
Yeah, so just thank you, Councilwoman Dewar, and thanks, Jeremy, for that excellent summary. And I don't have much to add on except to say that things are looking great. And we were in the very high in January. So I'm basically just showing you the curves of the true values and the predicted values. So the true is in blue, the predicted is in red, and we did quite well in terms of tracking what was happening in Jan. I think most of February we were doing quite well, I would say. Towards the end, we're seeing that the model's predicting, or model wants COVID to end, basically. So it is trying to go to lower and lower as much as possible, but like Jeremy said, actually, because of the indicator 4 variable getting stabilized and the other indicators going down, it's almost an anomaly, and which is why you're seeing these blue dots not matching the red ones. And that is majorly because of the the medical interventions, the indicator number 4 being stabilized. And I do think that those are because of the variances associated with lower values overall. Instead of being at 60% or 80%, it's basically pretty low comparatively. But I would still there have been reports of surges in other part of the country and all of that. So I would exercise caution to say that we try to avoid a surge or anything to do with that as much as possible, and follow all the protocols that Jeremy mentioned. So yeah, that's about it.
Well, thank you, Dr. Nair. And your words of caution at the end are very appropriate. And we're going to turn now to hear from our 2 doctors that are joining us today. And I hope, doctors, to hear you talk about the availability and utility of the vaccine, But I also hope that you will address what Dr. Nair just mentioned about maybe some resurgences in other parts of the country and what we need to do in Washoe County specifically to make that not happen here. So with that, I'll turn it over to Dr. Hess.
Hello, everyone. Thank you for having me. So really fantastic news about where we're at here in Washoe County. If you compare the numbers to where we were sort of the middle of December, sort of starting right after Thanksgiving, it was very bleak. The hospitals were very, very close to being completely overwhelmed. Our resources were spread incredibly thin. And unfortunately, mortality and illness was exceptionally high. And those numbers have dropped precipitously. I do want to point out that if you look over the last 3 weeks or so, we really have kind of plateaued. If you look at number of new cases today, they're kind of stuck between about 35 to 45 a day on average. And it's interesting, I was hoping as more and more vaccines get up, we get the uptake and we're getting the more at-risk population, we would start to see an uncoupling of cases and hospitalizations because they've matched right together since the very beginning of this thing. And whenever we see cases go up, we see a compensatory rise in hospitalizations. And then a few weeks after that, we see an increase in deaths. If you look at those graphs, you can see that our hospitalizations for COVID have plateaued as well. So they have not continued to drop. Now they're at a very manageable level. We've got enough resources so people can get care for both COVID and anything else. But as of right now, I think people are, the vaccine is a huge advantage for us for the future, but it's not really telling the story yet, where there's not enough of the population, even the high risk population that's had it, to really be reflecting that. What we want to see is if there are cases, we don't want to see the hospitalizations. And right now, they're still linked, which means we still need to do our preventative measures. We still need to socially distance. We still need to wear masks. We still need to wash our hands regularly, really limit our size of gatherings. Now, the CDC just came out, and I strongly agree with this, that once you have 2 vaccinated individuals, those individuals meeting together indoors without masks is acceptable, but we still want to limit the numbers. It still needs to be, small family gatherings, and it needs to be, it's not a license to go hog wild, because you still get a large group of people together. There's still significant risk there because it's still present in the community. And so that's kind of just the summary of where sort of things look right now. It's a lot better than it was. And I really truly believe that in a few months, as we get that population of the population as a whole vaccinated, that we really can, feel more comfortable about opening things up and not having these measures. But it's a little premature, certainly premature, to be looking at things like getting rid of masks. That's just not where we're at yet.
Wow. Okay. Let me ask you a follow-up. Do you know where we stand in terms of getting vaccine out to the community? I mean, the percentages or how we're doing?
I think if you look at the total number percentage where they've actually had both vaccines, now that's going to change with the Johnson & Johnson because it's a 1-dose shot. So, theoretically you get 2 for 1 in that scenario. I want to say we're in the teens as far as people who have had both vaccines. If you look at one vaccine, I think we're into the 20 percentile somewhere. So we're getting there, but keep in mind, to have that sort of herd immunity, you need those numbers in the 70s or higher. Now, granted, you can take into account to a degree the people who have previously had COVID, and there is some protection there, although the data is becoming very clear that the protection is significantly, and I will repeat this, significantly better with the vaccine than with native infection. So for, if you've had infection recently or it was a severe case, you do actually have some time before you need to get vaccinated. But if you are one of those individuals with a very mild or asymptomatic case, that protection is likely not there. And we shouldn't be counting those numbers when we be looking at this herd threshold. It really needs to be the vaccinated number.
Well, and this is a good time just to get that web address out there, which is to find out about the vaccine, get information about it, which is COVID-19 washovaccine.com. So COVID-19 washovaccine.com. They've made it almost into a mnemonic where you can remember it. So, and I know I do have some data that about 135,000 doses have been administered in Washoe County, which is good. I think it's 55,000 have received both. So we're well on our way with those first doses and lagging a little with our second doses, but I think people are catching up. And the numbers I have show that about 28% of the residents have received at least one, if not both, vaccines. So 28%, that's a pretty good number. Well, with that, let me turn over to Dr. Ariel and see what he has to offer us as well on the same topic. Dr. Ariel. And you're still on mute, Dr. Ariel. So
thank you.
here we go.
Thank you, Councilwoman Doerr, and for the excellent presentations we've had so far. There is a lot of good news, and I want to emphasize the new CDC guidance is not in to contravene the governor's directive. It is an incentive. Okay, what the CDC is telling us is if we vaccinate, then we can get together with other people who are also vaccinated in a private space, in a house or in your private house, take the masks off and relax and get a little bit more back to normal. This doesn't mean that you go out to a restaurant or a business or the supermarket or the school and take your mask off. It means you do it in your own private home with other people who are also vaccinated. And with care, you can even have somebody from another household who's not vaccinated. But you have to be careful about that, and you have to use common sense. This is and when you're with other people that you don't know, you put the mask on to protect them and to protect yourself as well. Nevada does have a problem with vaccinating, according to federal statistics. Nevada does rank second to last for doses received and doses administered. So we have a lot of work to do compared with other states. And in addition to that, we have to watch, there's a national trend last week, and I think this kind of ties into the statistics that Jeremy and Aditya put up. Last week, it was reported in the Wall Street Journal that we've plateaued in terms of new cases. And in fact, the 7-day average for new cases rose slightly nationally across the nation compared to previous weeks. This means that there is a potential for another surge. It doesn't mean it's going to happen, but there's a potential for another surge, and we have to be careful. And there are a number of reasons for this. First of all, the United Kingdom variant, the 7351 variant, the United Kingdom variant is spreading fast, and it might be the predominant strain in the United States in a few weeks. Also, there's another variant from South Africa and a P1 from Brazil that appears to be evading the vaccine to some degree, meaning a small study, meaning a few people were studied with this, and it showed that the Pfizer vaccine, the Moderna vaccine, and the J&J vaccine produced far fewer antibodies when people were injected with them, and then they were exposed to this variant. That means that the South African variant, if you have the South African variant and you're vaccinated, you're not creating as many antibodies to it. And so the protection is less effective than it would be for the other variants. That makes the South African variant more dangerous. However, it is not the predominant strain in the United States. The good news is that it's while the genetics of that variant make it more dangerous and make the vaccine less effective, it is not making it spread faster. The virulence and the infectiousness of this variant is kind of on the lower side. So the variant that's going to be the predominant one that's going to spread more easily through the population is a variant that vaccine is more effective against, all of them. That means the J&J, the Moderna, and the Pfizer. So that's good news. The other part of the good news, of course, is if you do the social distancing, wear your masks, wash your hands, all those measures work equally well no matter what the variant is. And so the bottom line is we're getting better, and the CDC has given us an incentive to vaccinate. I want everybody vaccinated possibly can, and so go out and get vaccinated as soon as you can, as soon as it's approved for you. But be careful, and I think we can get through this. We can get through this if we're all careful and we all use it. We all use common sense and we all work with each other to protect each other.
Well, thank you so much, Dr. Ariel. There are a number of other signs that things are improving. I have heard that the university is looking towards reopening school in a hybrid manner for virtually all classes. Some may be all in person, but at least hybrid for all the classes. And that's a huge step forward. Also next week, which is March 15th, we should move into the next phase of our plan with the governor. And what that does is that changes some of those caps so that we could be maybe looking at 50% capacity in restaurants and bars and gyms and casinos. So 50%. And also in-person gatherings increasing to up to 250. So that's a pretty huge change from 10 or 50 to maybe go to 250. You'll hear from our doctors, don't do it. They don't want you to go gather still. And I understand it, but one of the big drivers also has been sports, especially youth sports, adult sports tournaments. They're going to be able to resume if we put together a safety plan. Now, the safety plan is kind of complicated in that authority and responsibility would be shifting to the local governments. And I know our local governments are beginning to meet to talk about what that looks like. What would a safety plan be? And then once they get their arms around it, it would have to be approved by many different organizations, such as the Washoe County Health District, such as the Washoe County Board of County Commissioners, and most of the local jurisdictions as well. But it is a sign of improving times, the fact that we could potentially shift from sort of state management of what's going on to local management. And I think it's something to celebrate. We'll hear more about that, much more at our next briefing. And then, you know, we've mentioned about the risk meter and that it doesn't affect drive changes. It more reflects changes and provides you information about your own personal behavior. And on that note, I wanted to basically end or bring to a close this part of our news conference. And that is, I just want to do a shout out to those men and women who have been on our front lines that have helped see us through this. They have taken on jobs they never expected. They've served in positions and functions that they didn't foresee. Volunteers have come out to supplement the paid staff. And the paid staff, as we know, had reached a point of burnout some time ago. So we're very grateful to our volunteers, very grateful to our public safety officials, and very, very grateful to all of our healthcare workers, no matter what field they are in. And so with that, Matt, I'd like to draw this to a close and open us up for some questions.
All right, thank you very much to our panelists. A lot of great information there, and again, positive news for our community. So, and thank you as well to our media partners. And with that, we'll segue to any media questions that we have. First on my list is Channel 2, Cynthia Sandoval. Do you have any questions?
Hi, yes, I do. This is Cynthia from KTVN. Thank you everybody for giving us your time. I was just wondering, with the homeless, like what is the city, I guess, doing with efforts to let them know when their turn is up?
That is a great question that I don't know that I personally have the answer to, because I'm not on the front lines of the vaccine rollout. I could call upon Rebecca Venus, who's joined us. She may know more about how we're getting information out to our unsheltered population.
I think unfortunately that is a question we would have to defer to the health district. I know that they do have plans for vaccinations of our unsheltered populations, but because it's being managed through them, I would defer to them to be able to answer that question.
Okay, thank you.
Gave us a stumper, Cynthia, and that rarely happens.
And we're aware of Michelle's request as well, Cynthia. So I'm actually working with Scott over at the health district on that response. So just haven't been able to quite connect with him yet. But
no worries. Thank you so much for looking into it. Yeah, I know he's super busy, just like you guys during all this. So thank you though.
Okay, no more questions from Channel 2?
I'll let somebody else have a chance.
Okay. We'll go to Kinsey next with Channel 4. All right, nothing there. We'll circle back. Denise from Channel 8, do you have any questions today?
Nope, I'm good, thanks.
All right. And Bob Conrad from This Is Reno, do you have any questions?
No questions, thank you.
Okay, we'll circle back and see if Kenzie is on the line. All right. With that, I think we'll move on to any closing remarks that Councilmember Dewar has or any of our other panelists.
Sure. Well, first, let me ask the panelists, any last words before we close out here? No, it looks good. I just do want to say, and I say this every time, but it's with great heart and meaning, which is that our media partners have been our closest partners in this effort. Call it a war. Getting the message out, communicating with our residents about the who, what, when, where, and why. How do they get a vaccine? Where do they get a vaccine? What does it do? What are some contravailing information? How can you find out how we're doing as a community? What is the governor saying? All of this, you have been those conveyors of the information. Social media only goes so far. We all know that it has some reach, but I think locally, but all of our media partners have the greatest reach together. So thank you again for being here, staying interested, and stay tuned for some new updates. It looks like we'll really be potentially having a change with a kind of local option, if you will, taking the management of COVID-19 into our local hands. So with that, we'll bid you farewell.
I actually have one more question. Sorry about that. Dr. Hess, you said that the vaccine isn't telling a huge story yet. So when do you I mean, I know you don't have a crystal ball or anything, but when do you expect for us to kind of get a story of how vaccines are doing, one, and then two, Councilwoman Dewar, I know that you were super involved when there was the outbreak at Lakeside. I don't want to butcher the name, but Lakeside over there. So if the vaccines aren't telling a story yet, is it not known yet if there's, I guess, less deaths at those very vulnerable areas?
Dr. Hess first.
Sure. So, I think that I don't want to say that vaccines aren't having an effect. It's just we haven't seen bullying yet between cases and hospitalizations. That doesn't mean it's not going to happen or it's not starting to happen. It's just when you look at the data, we're just not seeing that yet. I honestly believe that within a few months, early summer, we will see that uncoupling where you may still see cases, but you should see much less hospitalizations related to those cases. It's like I said, it's difficult to predict at this point, but because we've had a very targeted approach to our vaccinations, really trying to hit the high risk and the elderly first, we should start to see those efforts pay off. And I think we are. It's just in the data, you're just not quite seeing it yet, but it's coming for sure.
As far as the information about care facilities in general, nursing homes, other kind of care facilities, you're absolutely right. I was very involved. It's called the Lakeside Health and Wellness, the organization. I don't have today's numbers with me, but I can certainly get those for you. I can take a quick look over the next day or so and let you know about that. But to Dr. Hess's point, we have seen hospitalizations drop, but they're still there. We have seen deaths drop, but they're still there. And so I think the question is, are they happening within our nursing home population still, which were the earliest, or, and these are the most fragile and the most vulnerable in terms of potentially getting COVID-19. But on the other hand, our community's got a lot more awareness in terms of how to deploy PPE and how to get it. So how to get it and how to wear it, they're doing better. So I don't have the numbers at hand, but I do know it is a cause of concern because you have so many people living together. That is why the emphasis has been on vaccinating older people, those over 65, and many people within care facilities are over 65. But I will also say that some of the facilities, these kind of group facilities, include much younger people. Whether it's in rehab, for example, you're recovering from a bone break and you have to go into rehab, maybe a hip fracture, or you are a youth that is in one of these facilities, or you are in prison. Anytime you have people that are in close proximity to each other, there is an elevated risk for COVID-19. So we'll check into the numbers and we can get back with you on that. And I appreciate the fact that you asked that question.
Of course. Thank you so much.
All right. Any more questions? All right. Well, seeing none, we'll bid you adieu for today. And we'll look forward to seeing you in 2 weeks. And we will come prepared with some of those other answers to other questions that you might ask. So thanks for joining us today.
Bye.
Thank you.